I want you to start this moment thinking about yourself. If you've recently noticed changes in the skin on your neck, such as small bumps, tiny skin tags, or darker areas that don't disappear no matter how much you scrub, today I'm going to help you understand why they appear and what you can do to help your body function in a more balanced way. This sign on your neck is not dirt or poor hygiene, and it's not about aging either. It's your body's way of warning you that something in your metabolism needs attention, and the good news is that we can correct it. Many of you tell me that even when you try to eat healthier or lose belly fat, your body doesn't seem to respond. And that's not because of lack of willpower. It happens because your metabolism is working at half capacity, especially when insulin resistance is present. When this occurs, your body enters a state of alarm and begins to store fat even when it shouldn't. The reassuring part is that this condition can be reversed. Today you're going to understand why your cells stopped responding well to insulin and how you can help them listen again by applying a type of metabolic rest that I will explain in detail. To make this easier to understand, I want to set aside the usual comparisons and use another image that makes everything much clearer. Imagine that each of your cells is like a neighbor who just wants to rest peacefully in their home. And insulin is the messenger who knocks on the door to deliver a very important package: glucose, the energy that comes from what you eat. Years ago, that messenger arrived only a few times a day. He knocked, the neighbor opened the door, received the package, and continued with their day. But over time, we've begun to eat constantly, snacking all day long, and now the messenger shows up from morning to night, again and again, without pause. The neighbor, exhausted by the constant noise, starts ignoring the door. Not because he's sick, but because he needs silence. To protect himself, he stops listening to the doorbell. That is exactly what we call insulin resistance. It doesn't mean your body is broken. It means it can no longer handle so many repeated signals. This stage is critical. We are not talking about diabetes yet, but rather an early warning. A moment when the system begins to fail, even if no one has explained it to you clearly before. To give you a better idea, let me tell you something very similar to what I experienced with one of my patients, whom I'll call Julian. He is 63 years old and works as an intercity bus driver. One afternoon he came to my office, sat down very slowly, and told me that after lunch he felt as if his body was shutting down. It wasn't normal fatigue, it was as if someone had flipped a switch. He had to stay reclined in the driver's cabin because he felt a strange heaviness in his stomach and a drowsiness he couldn't control. What he described is what I call the mid-afternoon blackout. His cells were so saturated that they couldn't let the energy in as they should. Glucose stayed outside, building up, while his pancreas released more and more insulin trying to open a door that was practically blocked. That's why Julian had high circulating insulin levels and, at the same time, a constant feeling of emotional hunger and exhaustion, as if his own body couldn't respond to him. And you might now be wondering what all of this has to do with the skin tags or dark patches you've noticed on your neck. The answer is direct. When insulin stays elevated for too long, it begins to activate other mechanisms that should not be triggered, including the exaggerated growth of certain skin cells. Before continuing, let me remind you of something important. If this information is helping you, I invite you to subscribe, share this video, and turn on notifications. Every day you'll find content designed to help you take care of your health in a simple and practical way, and you help others understand what their bodies are trying to communicate. If new marks, darker areas, or small skin growths have appeared on your neck, it's important to know that these signs can help you understand what's happening inside your body. Now I want to explain 3 clear indicators that can guide you. The first are those small, soft skin tags that usually appear on the neck or under the armpits. They are not dangerous, but they can indicate that your insulin levels have been higher than normal. The second sign is what we know as acanthosis nigricans, which is simply that dark, velvety pigmentation that appears on the folds of the neck, armpits, or groin. It is not dirt or lack of hygiene. It is the way your skin reacts when insulin remains elevated for a long time. Here I want to make an important clarification. If that dark patch appears very quickly, covers a large area, or is accompanied by unexplained weight loss, then a medical evaluation is necessary to rule out other possible causes that may be more serious. The third indicator is the buildup of hard fat in the abdomen. When you press your belly and notice that it feels firm and bulging, This is not just superficial fat. It is fat that surrounds your organs and, combined with insulin resistance, creates a vicious cycle that worsens both problems. And that can certainly become very harmful. But I want to remind you of something essential. These signs guide you, but they do not diagnose anything on their own. If you notice several of them, don't try to jump to conclusions on your own. A simple blood test can clarify the situation within minutes, and your doctor can decide whether additional tests are needed. If you recognize yourself in what I'm describing, let's go step by step and look at what you can start doing today. Before talking about solutions, I want to answer a question many of you have asked me since the video about fatty liver. Dr. Mena, what comes first, fat in the liver or insulin resistance? The truth is that one fuels the other. Sometimes we don't even know which one began the problem, but we do know that both conditions amplify each other. When your liver accumulates fat, it stops responding well to insulin. And if you already have insulin resistance, your body tends to store even more fat in the liver. The good news is that you don't need two separate treatments. There is an approach that helps improve both issues at the same time. I call it the silence therapy. I use that name because many times it's not about adding more medications, but reducing the constant metabolic noise your body cannot handle. Of course, medications can be useful, but the first step is to reduce that noise. Let's look at how you can apply this therapy in 3 practical steps that break the cycle from day one. The most important step is to avoid sending signals to your body all the time. If you eat 5 times a day, it's like knocking on your cell's door 5 times without giving them time to recover. That's why I recommend having 2 or 3 complete and satisfying meals, adapted to your age and lifestyle. Everyone is different, but it's essential to give your cells 3, 4, or 5 hours without insulin stimulation. It's not about starving, it's about avoiding constant snacking between meals. To achieve a true sense of internal rest, there are certain sources of noise we need to eliminate completely. I'm talking about alcohol and sugary drinks. Those beverages are like putting a loudspeaker directly into your cell's ears. If you reduce them to a minimum, or even better, avoid them entirely during this therapy, your recovery will be much faster and much more noticeable. And I want to warn you about something extremely important. If you have diabetes and use insulin or medications to lower your blood sugar, never make abrupt changes to your meal schedule or portion sizes without consulting your healthcare provider first. Sudden adjustments can affect your glucose levels and lead to dangerous drops. The last thing we want is hypoglycemia. The second step of this therapy is what I call the butler trick. What do I mean by that? It's about the order in which you eat your foods. Don't start with what makes the most metabolic noise. Avoid opening your meals with bread, rice, or potatoes. If you've noticed changes in your neck and you're trying to understand how to improve your metabolism, what you eat, and the order in which you eat it, can help you tremendously. That's why I want to explain something very simple. Begin your meals with vegetables, which are rich in fiber, and then move on to proteins. Why do I recommend this? Because both are absorbed slowly without creating internal noise, and they prepare your body for what comes next. Research shows that when we leave carbohydrates for last, the insulin spike is much smaller. The same plate, but in a different order, allows your body to work calmly. The third step I want to teach you is what I call the service door. It's one of my favorites because it helps both insulin resistance and liver function. After eating, go for a 10-minute walk. That small amount of movement opens a direct pathway into your muscles so glucose can enter and be used without forcing your body to produce more insulin. You don't need intense exercise or sweating. Just walk. I assure you it's one of the most effective and simplest ways to improve your insulin sensitivity. And if walking is difficult due to pain or physical limitations, don't worry. You can move your feet while sitting, lift and lower your heels, or make gentle leg movements. The important thing is that your muscles contract, even a little. That alone opens that back door that helps your body use sugar more effectively. If you want to take another step forward, you can include 2 or 3 days a week of muscle strengthening activities. You don't need a gym. Wall-assisted squats and push-offs, always adapted to your abilities, are enough. Muscles are the biggest users of glucose in the body. The more you work them, the more doors you open to improve your metabolism. Something many people ask me is, Dr. Mena, what if I'm already taking metformin to lower my sugar? And the answer is a very positive one. Metformin helps correct chemical imbalances, while structured eating reduces metabolic noise. They complement each other very well. Do not stop your medication. Use it as support while you apply these changes. And as I always say, if you're going to modify your meal schedule or quantities, talk to your doctor or nurse first to avoid dangerous drops in blood sugar. Your task for today is simple yet incredibly powerful. After each meal, take a 10-minute walk. That single habit begins to improve your body's entire internal communication. But there's something else you need to know. For your cells to remove the earplugs that disconnect them, your body needs certain minerals. Magnesium, zinc, and even chromium help everything work more efficiently. A good diet usually covers those needs, but many people wonder whether taking supplements will cure them. The truth is that supplements alone won't cure anything, though they can support the process. The problem is that most people who take supplements to improve their blood sugar end up making a mistake that renders them completely ineffective. In some cases, supplements even cause discomfort. If you want to learn how to avoid that mistake and use them correctly so they truly help you, watch the recommended video. There I explain step by step how to use them without blocking your progress. Before I go, I want to briefly tell you about Carmen, a 67-year-old patient I treated a few months ago. She arrived worried because her neck had become darker with more folds. She told me, "Doctor, I feel like something isn't right, but I don't know where to start." She applied these 3 steps exactly: meal order, post-meal walking, and gentle strengthening. 2 months later, her neck was clearer, her energy improved, and the most beautiful part was hearing her say, "Now I feel like I can restore my health." I share this with you because maybe you or someone you love is going through the same thing. If so, share this video so more people can understand what these changes mean and make informed decisions. And since you're here, if this content is helping you, I warmly invite you to subscribe to the channel, turn on notifications, leave a comment, and share it. Every day we upload a new video designed to support your health and give you practical tools you can use at home. I also want to invite you to something very special. Take a moment to thank God for life, for the strength that sustains you every day, and for the opportunity to learn how to improve your well-being. That gratitude opens important doors within us. Here on Dr. Gabriel Mena's channel, we are truly grateful to accompany you and be part of your journey toward better habits and a healthier life. Tomorrow you'll have a new video that I'm sure will be useful. I'll be waiting for you with open arms so we can keep learning together. Take care of your health and keep moving forward.